Hi guys, I really like the title of this chapter, The Dental Hygienist-Patient Relationship. That makes it sound like some friendly thing. We're talking about being sued and laws and all that kind of stuff. So the title's a little misleading. Okay, so when we talk about this, basically what it's trying to tell you is that we have to kind of have standards to know the quality of care. And we've talked about this previously, some of the standards set up for dental hygienists. And it requires a commitment of both parties. Both have certain expectations. Professionals have obligations to comply with governances. So if you cannot provide or meet their expectations, the patient can choose to go to somebody else, right? Okay. So, because you're a professional, your relationship with your patient is legally binding, meaning that they have certain expectations that they expect from you, and if you don't fulfill them, there could be legal consequences. So this is based on societal beliefs of protective rights. And when you think of one of our core values, it's societal trust. So society expects hygienists to act and behave a certain way. There's retribution for harm via civil and criminal litigation. So I want to kind of get into the differences between civil and criminal offense. A civil offense is what is going to most likely happen with businesses, because what it's saying is you expected something to happen and it didn't happen. However, a criminal offense is more like an active thing of aggression. So say this person beat you up or something to that effect. It's more like intentionally causing harm. However, civil offense is, malpractice. The example here is not treating perio and causing increased bone loss, something to that effect. So that would be considered a civil offense. So let me move this forward. Where did my pointer go? There we go. Okay. It looks like I've got one more slide before I'm going to get into that. But so the plaintiff is the party bringing the claim, and the defendant is trying to defend the claim. Discovery is the evidence gathered from interrogations and depositions, and then a trial results of the claims and allegations, and the judge decides the law. Juries decide the facts. So, in a criminal case, because criminal cases, remember this is a person that beat you up or murdered you or whatever, these people can be sent to jail for their actions. So the person bringing the case has to prove that this happened beyond a reasonable doubt. So that's kind of more like 95% sure that this has occurred, right? Now, a civil case, remember this would be something more often a breach of contract or something, with a business, those kind of things. This only has to be above 50%. So that means a preponderance of evidence means that you have to have at least a 51% chance that this actually happened. So remember, criminal cases, we'll talk about this actually in the next slide. Nope, it doesn't. A criminal case can send that person to jail for life, whereas a civil case, and the criminal case needed that 95% chance of being accurate, and then the civil case only needs a 51%, and it's usually being charged money or fines or losing your license or something to that effect. Okay. So now we're going to talk about contract law versus tort law. So a contract law is an agreement to keep a promise. So meaning, you told them that you were going to do a crown and you actually did it. Okay. A tort law is like what is expected of you from society. So an example of this would be, well, when I go to the dentist, for my 6 month cleanings, I'm expecting them to keep me, let me know if there's some issues with periodontal disease or something to that effect. So if you didn't tell them that, that would be, tort law. Contract law is more like, hey, I signed my informed consent and you never followed through with it. An important thing to know about contract law is that it can be implied or written. And so, when a person shows up in the dental office, they are implying that it's okay for you to take radiographs and, do an exam. But we always have them kind of sign those forms at first, just so that, we cover our bases legally, right? A failure is a breach of contract remedied through the judicial system. Okay, so then we have a tort law, and we have an intentional tort is a deliberate, purposeful action against a person or property, or an unintentional tort, which means I didn't mean to do something wrong, but this happened. Okay, I'm going to tell you an example of each. Let's move to this intentional torts. Many of you probably, this just happened like the last couple weeks, I think I heard this, but there was a dentist in Wisconsin, and what he was doing is he would go in and start to drill a tooth and cause damage to it, and then he would snap a picture of it with his intraoral camera, and then he would say, oh, you need a crown, and he would bill them for a crown, and getting all sorts of money for all these crowns. I think they said usually it's 6 per a practice might do 6 per week or something. I can't remember what it was, but this guy was doing like 30 per week, so considerably higher than everybody else. So that's intentional, meaning he's actually fracturing that tooth. That would be an intentional tort. Here's some other examples of intentional tort. Battery, so hurting, hitting somebody. Assault, they're causing apprehension, but there's no physical contact. Misrepresentation, which is a false representation, false imprisonment, emotional distress, slander or libel resulting in defamation. Intentional torts to property would be like a physical intrusion without authorization. So if somebody breaks into your house, or an interference with possession of property. So I'm thinking something about your car. I'm not sure exactly. An unintentional tort is when you don't mean to specifically do something. So, for example, negligence is an unintentional tort, a failure to act as a reasonable, prudent person under similar circumstances. So, if everybody else is probing teeth and you haven't probed anybody for 10 years, you might have some negligence on your hand. Another example of an unintentional tort is when you give local anesthesia, there is sometimes a risk of causing paresthesia where that person stays permanently numb, maybe on their tongue. Or sometimes when they extract a tooth, it nicks the nerve there and it will cause them to go permanently numb. Did you mean for that to happen? No. Did it happen? Yeah. Does it suck? Yeah. And so they could sue you for an unintentional tort. Keep losing my mouse. Okay. Here are some responsibilities that dental hygienists have. You should have a current license in the state you're in. It must be displayed. You must renew it. You must have the CEs to renew it. You can only do the activities that you're legally allowed to do in your state and with the appropriate supervision. So if you have to have a dentist on site and you're not doing that, you could be sued. You must meet the professional standards of care. Use professionally recognized drugs, materials, and techniques. sometimes people order stuff from China or like weird things like that where they don't have quite the standard that we do. You could be in trouble for something like that. The treatment must be completed in timely manner. Your fees must be usual, customary, and reasonable. It's kind of like that case that we talked about last week where he was charging more to those from other countries or whatever. Treatment cannot be stopped if harm will result, or treatment cannot be stopped if harm will result, meaning, you know, you're in the middle of a crown prep, you put the temporary on, and then you leave them and you don't ever, you know, try to put the real one on. Abilities and limitations must be understood. Referrals made as appropriate. So, you know, if it's out of your league and you don't refer to a periodontist and that person loses their tooth because you didn't refer, you could be in trouble. Respect the patient's right to privacy, following HIPAA, you know, through social media and anything else. Patient records need to be logical, complete, and accurate. Pre-treatment and post-treatment instructions must be appropriate and understandable. And written instructions are always great to clarify. So these are the responsibilities of the patient. You have to pay for your services, cooperate in care, and keep your appointments. So if you say to them, you know, I need you to floss every day, I need you to show up every 3 months, and they show up every 3 years, you know, you're not going to be liable because they're not doing their part in it. Provide accurate answers about dental or medical history and current health status. So if they don't tell you they're on a blood thinner and then they go home and bleed to death, you know, are we liable? No. Follow instructions, including home care instruction. These are the 3 most common legal actions related to healthcare: failure to obtain informed consent, professional malpractice, and breach of contract. Okay, so when we talked about these standards of care, ADHA has kind of set some of those standards for us, and if we follow them, we will prevent legal action. So we should provide oral health care utilizing high levels of professional knowledge, judgment, and skill. Maintain a work environment that minimizes the risk of harm. Serve all patients without discrimination. Hold patients confidential, so we're following HIPAA again. Communicate with patients in a respectful manner. Promote ethical behavior and high standards of care. Serve as an advocate for the welfare of patients. Provide patients with informed decisions and provide them all the information they need. Refer to other patients when their needs are beyond the scope of practice. Educate patients about high-quality oral health care and recognize that cultural beliefs influence patients' decisions. Okay, I think we're going to stop there and then we'll do another video in part